This is fungal acne, this is hormonal acne. But this is not fungal acne, and this is not hormonal acne. In this video, I will show you the simple way to tell the difference between fungal acne versus hormonal acne in 5 different ways. So we're gonna talk about the 5 things you need to be looking for in your acne in order to see whether it's caused by hormones or by skin fungus. So if you don't know which of these forms you have, this video is everything you need. I will also explain you how to treat each of them, so how to fix your acne from the root and get clear skin. So if you're ready, let's get into it. Hello and welcome to Acne from A to Z. I'm a pharmacist, and on this channel I teach you how to get rid of your acne by fighting its root cause. So if this is something you are interested in, make sure to subscribe and also follow me on TikTok and on Instagram for daily videos and tips about acne. Now here are the things we are going to look at in this video. We're gonna start very briefly with the main signs of fungal acne and hormonal acne, and then we will get straight off to the 5 differences between them. So how to tell if your acne is fungal or if it is caused by hormones. And like I promised, at the end we will look at the best treatment and the best way to get rid of each of these forms of acne, depending on what you have. Now if you are ready, let's get straight into it. First of all, what are the main signs of fungal acne and how can you tell if your acne is fungal? And as a general rule, I would say that pimples caused by fungal acne tend to appear in groups, in clusters. They are usually very small and have similar sizes. And for this reason, it's pretty easy to differentiate them from any other forms. Besides, one specific thing about fungal acne is that it is very itchy, so more often than not, pimples that are caused by skin fungus will be itchy, not painful, not very inflamed. Instead, they will always be itchy. Since it is caused by skin fungus, fungal acne will only respond to a certain type of skincare which is specifically targeted to fight that skin fungus. But we are going to talk about this a bit later on when it comes to the treatment of fungal acne. But what you want to remember is that if you use regular acne skincare on fungal acne, things like benzoyl peroxide, salicylic acid, azelaic acid, these kind of ingredients that usually work for regular forms of acne will not work for fungal acne. So this is another really good way to tell if you are actually breaking out because of skin fungus, not because of skin bacteria or oily skin, which typically respond to this kind of ingredients. Now, if you want to learn more about the signs of fungal acne and how exactly you can recognize it, I have another video where I talk in detail about its most specific symptoms, so I'm gonna link it below. Make sure to check it out if you're interested. Moving on to hormonal acne, I would say that this form of breakouts has some very specific signs, and more often than not, it causes pimples mostly on the lower face, so on the chin, on the jawline, on the neck, in the lower side of the cheeks, and also sometimes around the mouth. Instead, hormonal acne never affects the forehead, so there's a big difference between the upper part of your face, which is very clear, and the lower one, which is usually full of pimples and cystic pimples. This is another thing about hormonal acne. It usually causes breakouts that are very aggressive, very inflamed, painful, and they usually leave scars behind since they are very severe. Just like fungal acne, it doesn't really respond to regular acne products and acne skincare simply because its root cause is something internal, and those local products don't necessarily target its internal imbalance. This is why with hormonal acne, you will always have to focus on that imbalance in your hormones, on its inside cause, if you want to get rid of it. But like I promised, we are going to talk about this in detail a bit later on. I also have another video where I talk about all the signs and symptoms of hormonal acne, so how exactly you can identify it, because there are many other things that I can't really mention in this video because it would make it way too long. So I invite you to check my other videos about the signs of hormonal acne as well. Now let's get into the main differences between fungal acne and hormonal acne. So how exactly you can tell if you have one or the other, what are the things that you need to be looking at, and we have actually touched some of them when we talked about the signs of fungal acne versus hormonal acne, but right now I am going to tell them and state them specifically. So the first difference, the first thing you need to be looking at is your acne's position, and that's because fungal acne tends to affect the forehead and additional body areas like the chest, the cleavage, the shoulders, and sometimes even the back. And this is actually closely related to its cause, so to its trigger, to the yeast called Malassezia, which is responsible for triggering fungal acne. And a lot of times people who have this Malassezia also have scalp dandruff, simply because this yeast also causes scalp dandruff. For this reason, it's super easy for that fungus to migrate from your scalp on your forehead, and it can also follow from your scalp on your chest, on your shoulders, and on your back. This is why fungal acne tends to appear more often than not in these areas. But a lot of people who have fungal acne don't necessarily have scalp dandruff as well. And even so, they still tend to get their fungal acne in those areas predominantly. And this has a lot to do with your sebum production as well, because your face tends to make a lot more sebum in these areas simply because there are more sebaceous glands in those areas. And this is the reason why fungal acne usually appears on the forehead and on those body areas that I mentioned as well. This doesn't mean that you cannot get fungal acne if you see some breakouts on your chin, on your cheeks, on your nose, and so on. But these areas are generally a lot more rare compared to the forehead and to those body areas. On the other hand, hormonal acne is extremely specific in terms of location, so it will never affect the forehead. Instead, like I said, it always affects the lower face, so your jawline, your chin, your neck, the area around your mouth, sometimes even your cheeks, especially the lower side, but it will never affect the upper side of your face. Hormonal acne can also appear on your chest, on your cleavage, and also on your back. However, I would say that these are mostly secondary areas, so if you are breaking out because of your hormones, your acne will mostly appear on the face, on the lower face, and only secondarily on your body. So this is a rule you can remember if it's gonna make it easier for you to recognize hormonal acne. If you are interested in what the position of your acne can tell you, on what exactly it can indicate you, I actually have a video about how to do a correct face mapping for your acne, so how to look at your acne's exact location and what this tells you about its trigger. I'm gonna link my video below. I promise it's gonna be really helpful, and it can be a real eye-opener for many of you who have been struggling with acne and you can't really tell what is triggering it. The second difference between hormonal and fungal acne is the way their pimples look. So let's start with fungal acne, and if you remember when we talked about its most specific signs, you probably know that fungal acne tends to cause breakouts that are small, that are grouped together, so you won't really see many individual pimples if you are breaking out because of skin fungus. Those pimples may or may not be inflamed. Inflammation is not a necessary sign of fungal acne, and if there is some inflammation, it is going to be pretty mild, so fungal acne will never cause those cystic breakouts that are very aggressive and very severe and which usually leave marks behind. Instead, when it comes to hormonal acne, things could not be more different. And that's because hormonal breakouts usually cause cystic pimples, so hormonal acne is very aggressive, it's very inflamed, it's often painful. If you've ever had a blind pimple, you probably know what I'm talking about. Blind pimples are actually very common in hormonal acne, so hormonal imbalances are not the only potential trigger of blind pimples, but a lot of people who actually have blind pimples develop them because of an imbalance in their hormones. So when it comes to the aspect, the way your pimples look, it's pretty easy to tell if your acne is fungal or if it is hormonal, because they are totally different. The third thing you need to be looking at is your scars, whether they are present or not. And this is actually super important because in hormonal acne you will always see scars. So after your pimples heal, let's say they heal in something like 4 or 5 days, after that they will usually leave marks behind, and those marks typically take something like 7 to 10 days to go away completely. Sometimes even more. It obviously depends on how aggressive and how severe your pimples were, but you want to keep in mind that scars are a very specific sign of hormonal acne, and that's because hormonal breakouts are very aggressive, and generally if you have pimples that are very severe, very aggressive, very inflamed, you can expect them to leave marks after they heal. When it comes to fungal acne, things are totally different. So fungal acne will never leave scars behind. Whether those pimples are inflamed or not, you will never see any marks after they heal. So once fungal acne goes away, you're not gonna get any scars, any marks. They will simply go away normally and not cause you anything behind. This is probably because fungal acne is a lot more mild in general. So this is also something that you can use to tell if you have fungal acne or not, because if your breakouts are caused by skin fungus, they will never be very aggressive, very inflamed, and very severe. This is why you will not see marks behind after those pimples heal. If you do see them, it was not fungal acne what you had. The fourth difference is something very specific to fungal acne, and I am talking about itchiness. Now, I'm not sure if you watched some of my previous videos where I talked about fungal acne or not, but if you did, you probably know that itchiness is the specific sign of fungal acne, and actually it's only fungal acne that itches. So it's the only type of acne that has these symptoms. Hormonal acne, gut acne, or any other forms do not have itchiness among their symptoms. Most of these forms of acne cause pimples that are painful, so fungal acne is the only one that causes breakouts that are itchy. For a lot of you, this may be the easiest way to tell the difference, so it's gonna be the easiest sign of fungal acne, and you can definitely use this in real life, because if your pimples are itchy, they are most likely caused by skin fungus. Now, someone recently asked me whether they can have fungal acne if their pimples are not itchy, and the answer is yes. So even though your breakouts are not itchy, they can still be caused by skin fungus. But in general, I would say that many cases of fungal acne have itchiness among their symptoms. It's not a must, but it's a very common sign. So you definitely want to look at the other symptoms you have as well if you want to make sure that your acne is fungal. And the last difference between fungal acne and hormonal acne is the way they respond to skincare. And here we actually have one common ground, and I'm talking about the fact that neither hormonal nor fungal acne responds to classic acne skincare. Things like benzoyl peroxide, salicylic acid, azelaic acid, retinoids. If you have one of these forms of acne, none of these ingredients is actually going to help you, simply because they do not focus on fighting your acne's root cause, which are hormonal imbalances and skin fungus respectively. So this is the common ground these two forms of acne have. However, the difference here is that they do respond to different kind of products. And actually, fungal acne responds really well to antifungal skincare, so to products that are specially designed to fight that skin fungus. However, those products aren't necessarily helpful for hormonal acne, so if you apply those kind of products on your hormonal pimples, they will most likely not have any effect, or in the worst case, they can also irritate your skin simply because the root cause of your acne is internal. So applying this kind of antifungal creams is not going to bring any benefit for your pimples. But like I promised, we are going to talk about this in a few minutes in detail, so I'm going to explain you exactly what you need to use if you have fungal acne or hormonal acne respectively. But keep in mind that fungal acne will be treated with skincare, will respond to skincare as long as that skincare is designed to fight skin fungus. But this is not the case for hormonal acne, which will never respond to skincare. Now let's make a really quick revision and see how exactly you can tell the difference between hormonal and fungal acne. First of all, you want to look at your pimples position. So generally, if they affect the lower face, there are high chances that they are hormonal, and if they affect the forehead and also several areas from your body, they have much higher chances to be fungal. At the same time, if your acne is fungal, it is usually more mild and itchy, while if it is hormonal, it is more cystic, more aggressive, and it usually leaves scars behind. At the same time, neither hormonal nor fungal acne will respond to classic acne products, but fungal acne will respond really well to antifungal treatments that are usually local, but those will not have any effect if your acne is hormonal. And now that you know what exact form of acne you have, it's time to talk about how you should get rid of it. So let's start with fungal acne, because things are a lot more simple here, and I would say that fungal acne is one of those forms of acne that responds fast to treatment, and you usually manage to see results very fast, sometimes even in a few days, as long as you use the correct treatment. And like I always say, if you want to get rid of your acne, you need to focus on fighting its root cause. So in this case, the root cause of of your acne is this yeast, this skin fungus called Malassezia. So if you want to get rid of it, you are going to use products and treatments that are designed to fight the skin fungus. Now, my top recommendation are antifungal creams. They are by far the best and the easiest way to get rid of fungal acne, simply because they target that Malassezia yeast really specifically. So they are going to have the best effect out of all treatments out there. I know that in a lot of countries, antifungal creams require a medical prescription, so my advice is to see a dermatologist if you have the possibility. It would also be the best for a specialist to diagnose your acne and to tell you for sure whether it is actually caused by skin fungus or not. And if this is the case, your dermatologist will definitely prescribe you an antifungal cream. Another option you have is to use an anti-dandruff shampoo, and like I said, scalp dandruff is caused by the same yeast, by the same fungus as fungal acne. This is why in general anti-dandruff shampoos work really well for fungal acne as well, and there are many options out there. Pretty much any dandruff shampoo works. I know a lot of people have treated their fungal acne with an anti-dandruff shampoo and they have had really good results. So in this case, you would basically apply it every time you would shower, especially if you also use that shampoo on your scalp. You would just let it sit on the affected area for a couple of minutes and then rinse. And you should be able to see some results, some improvement in your acne after a couple of uses, especially if your acne is caused by skin fungus, obviously, because otherwise you're not going to see any change. For those of you who are into home remedies, probably the best home remedy for fungal acne is tea tree oil, but you always want to dilute it, so combine with a carrier oil. And I actually have a more detailed video about how to use tea tree oil for acne, in which forms of acne it works best, so I'm gonna link that below. But my first recommendation would be to go for either an antifungal cream or an anti-dandruff shampoo. In my opinion, these options are a lot more accessible and a lot easier to use compared to a tea tree oil, which you would have to dilute with a carrier oil, and this can be a bit tricky. But all in all, getting rid of fungal acne should be extremely easy. On the other hand, things are a bit more complicated with hormonal acne because, like I said, you have to focus on the specific imbalance you have in your hormones. And for those of you who are not sure what exact hormonal imbalance they have, I actually have a free PDF in my description with the things you need to analyze, the tests you should take in order to see what hormonal imbalance you have. The list is completely free and I promise it is going to help you so much, so I'm gonna link it in my description and you can check it out there. And for the sake of this video, I will take the most common hormonal imbalance that causes acne, so the most common problem that causes hormonal breakouts, and that is an increased number of androgen hormones. And I would say that so many cases of hormonal acne are actually because of these androgens. And in order to get rid of your breakouts, you basically have to bring them into their normal limits. Now, how exactly can you do this? There are actually a lot of remedies you can use. If you are a woman, you can go for classic treatments like birth control, certain birth control, and also spironolactone, as long as they are prescribed by a doctor. So if you suspect you have hormonal acne, you can either see a dermatologist or a gynecologist. It's up to you. He could prescribe you the right treatments. And for those of you who want to go on a more natural route, there are also many alternatives as well. And probably one of my favorites for high androgens is spearmint tea, because it is super easy to use and it is super easy to find as well. I know some people told me they couldn't really find spearmint, so they asked me whether they can replace it with peppermint. The answer is no. Either you go for spearmint tea or not, because peppermint doesn't have the same androgen blocking properties as spearmint tea. This is why you should not use peppermint tea for hormonal acne, simply because it is not going to help. If you can find spearmint and use spearmint tea, this is probably a very easy alternative. The thing you want to remember here is that if your hormonal acne is very aggressive, spearmint tea may be too weak, simply because in a tea, spearmint is not very concentrated. So in this case, what you can do is to go for a spearmint supplement, which usually has a much higher dose. So it is going to have a much stronger effect if your hormonal acne is very aggressive. But it is definitely worth trying, so you can begin with a tea and see if you manage to see any improvement after something like 1 or 2 weeks. But spearmint tea is not the only thing that works for hormonal acne. There are actually many other herbs that are effective, especially when it comes to decreasing high androgens and to bringing them back into their normal limits. And some of the things I could also mention here are supple meadow, licorice, peony, especially this combination of licorice and peony is great. Pumpkin seed extract is also a really good option. Nettle root as well. Nettle root is also really effective for hormonal acne and for balancing high androgens. Now, a lot of times I have noticed that you get some much better results if you combine these herbs. So if you use supplements that are based on several of these herbs combined, not just on one. So this could also be an option depending on what exactly you find, whether you buy them online in your local shops or online in the shops from your country. And I'm actually preparing a masterclass about how to get rid of hormonal acne. So if you know you have hormonal acne, I'm preparing a masterclass with the step-by-step routine and product recommendations you can use in order to balance your hormones. If you are interested, I'm gonna link it in the description. Now, for hormonal acne, I wouldn't necessarily recommend focusing a lot on skincare. You can definitely use skincare additionally, but you should not invest and spend a lot of money on expensive skincare products simply because in this case they don't necessarily have a much better effect than normally priced skincare. And this is because hormonal acne has an inside cause, so until you balance your hormones and bring your androgens back to normal, you're not gonna get rid of your pimples. And even though you use skincare and those products manage to dry out your pimples, you will still continue to break out on a regular basis. This is why I would not insist so much on skincare for hormonal acne, especially not as a main treatment. Instead, you should focus on internal products, whether I'm talking about supplements, teas, tinctures, or anything you have good results with. You can also check my free ebook. I'm gonna link it in the description, and it talks about the 7 most important types of acne, including hormonal acne, and I actually give you some really good treatment recommendations there. So the kind of herbs, the kind of products you should be looking for if you wanna balance your hormones and bring your androgens back into normal. But compared to fungal acne, hormonal acne is generally harder to treat, and it is going to take a lot more time, a lot more patience, and you have to be a lot more consistent if you want to see results, simply because its cause is internal and it usually takes a lot longer for you to balance your hormones than to get rid of your skin fungus. I really hope that this video helped you understand whether you have hormonal acne or fungal acne. So I'm waiting for your feedback in the comments below, and please let me know which form of acne you have based on the differences and the signs I have presented you in this video. Also, let me know what kind of videos you would like to see, so what other acne related topics you are interested in and you think that a video from me would be helpful. So until next time, I wish you to stay acne free.